Good morning, everyone, and welcome to County Executive Pittman's virtual press conference. This morning, the county executive will share updates on the county's response to yesterday's snowstorm and on COVID efforts. I will take questions after the updates. As a reminder, please put your name and media affiliation in the chat, and I'll call on folks for questions in that order. And please keep your microphone and camera off unless you're called upon for a question. With that, Mr. County Executive.
Thanks, Jeff. Can you hear me? I've got to hit this button here.
We can hear you.
Okay, good. Well, thank you for joining us, everybody, on this very coldest day of the year so far. I want to start with the storm, then I'm going to talk about COVID, and then a couple of other things related to the county council. The snow hit us pretty hard. Looks like it was about 11 inches where I live in South County, and up to 12 in Churchton, and a little less than that as you move north in the county. And I want to thank our team at the Office of Emergency Management for coordinating our countywide response. As you know, I think we have regular calls with all the departments involved in responding to these weather events. And as always, they're very efficient and they do a great job. The roads are not all clear yet, and power is not yet back on for everybody. And I think the cold weather is slowing some of this down. So I want to go through some of those facts and figures. On power outages, good news is that we are down to about 4,500 outages. We were at around 11,000. It actually hit 30,000 for a very brief period when there was a large outing in the Annapolis area. But fortunately, that one got fixed quickly. If there is need for shelter tonight through the Office of Emergency Management, that will be coordinated for those who don't have power yet. On road closures and road clearing, particularly on clearing, as of 4 o'clock this morning, we had 55 county and 127 contractor plows still operating, still working. We have used 2,067 tons of salt. That's 12% of what we have in our stores right now. 14,000 left, and we use 3,000 gallons of brine and have 29,000 available still. The priority 1 roads, 65% are clear. Those are the arterial roads. The collector roads, 60% clear. These are to the pavement. And then our local priority 3 roads are 57% cleared as passable as of 4 o'clock this morning. So that work is continuing. And if you want to monitor some of that, you can go to aacounty.org/county-operations. And then, of course, if you want to check power outages, go to bge.com/outages. So again, I want to thank everybody in county government for their hard work, and everybody in our communities. Hope that you are doing well. It's beautiful out there, but it's awfully cold. So stay safe, stay home if you can. As you know, county schools are closed and county offices are closed for most of us. Next, I want to talk about COVID. The governor was just on and announced a 30-day declaration of emergency for the state of Maryland. Yesterday, he was on and announced a mask mandate in state buildings for both employees and for the public. And the numbers are really beyond what was projected even a couple of weeks ago and a week ago in terms of hospitalizations in particular. The COVID case rate is really unknown at this point because we only have the data from these PCR tests. Most people are testing with take-home tests. There's a shortage of PCR testing for the kinds of numbers that we have right now of infections. And so the number of infections is higher than what is reported. I think there's consensus on that. But more importantly, we know exactly what's happening in our hospitals. And as of yesterday, when I met with our 2 hospitals, we had 252 COVID patients hospitalized. We were shocked when it went from the low 40s into the low 80s just about 2 weeks ago. And these numbers just keep shooting up statewide. Yesterday, we heard that we hit the 2,500 threshold. And today we're hearing that it's already over 3,000 hospitalized COVID patients. And as you know, the patients move from hospital to hospital. Wherever there is space, they go. The hospitals, by state mandate, coordinate with one another about where patients can go. And so, I mean, the hospitals can certainly speak for themselves about what it means to be under these crisis standards of care and postponing surgeries and making space for additional COVID patients and attempting to staff at a time where they not only have a staff shortage to begin with, but also a lot of staff who are out due to COVID infection. So still the majority of those patients are unvaccinated, and that is a big part of our problem. So we're continuing to stress that everybody should be vaccinated who is 5 years or older. Only 30% of about 33% of our school age kids, or our 5 to 12 kids, are vaccinated, and that number needs to increase. But we have to do everything we can, no matter what your political views are or what your feelings about government's role in this. As individuals, every single one of us absolutely needs to get vaccinated, get boosted. And as the governor said earlier today, wear the damn mask, that we need to have people masked when they're in public places to slow the spread. Cloth masks are not as good as surgical masks, which are not as good as N95 style masks, but all of them are important and all of them slow the spread. I think it's well known by now that December 30th, I announced it on the 31st, right before New Year's Eve, that Anne Arundel County would join all of the neighboring counties in central Maryland with an indoor mask mandate in public places. And that is in effect through Friday. The county council will make a decision Friday as to whether to extend this. There are 2 bills before the council that do that, and I'm encouraging folks to make their views known on this. We are pretty sure that 4 council members will support some sort of an extension of the mask mandate, at least through the end of this month. It takes 5 votes though, and we have a 7-member council. So we need at least 1 more vote beyond those 4. And so I encourage folks to contact their council members. You can go to aacounty.org and go to county council and get all the information you need about how to provide written testimony for this meeting that will take place on Friday. It's a special meeting that was called, and let them know how you feel about masks. If you want to continue to slow the spread of this virus, I highly recommend that you support extension of this mask mandate. I want to say that I have no intention of closing businesses or any of the tools that we used before we had a vaccine. But masking is something that I think we can all manage, and that when the mask mandates are implemented by government, we do find that there are more people who mask. You go into department stores right now and all kinds of stores, and it varies by community, but the counties that have mask mandates in effect now have a much higher rate of masking than the ones who don't, as you would expect. Not everybody complies, but most do. So enough said on that. I also want to note, though, on the masking, that Baltimore County was in a very similar situation to ours, and last night voted 6-1 to extend their mask mandate. It was a bipartisan vote in support, and we hope to have a bipartisan vote in support in Anne Arundel County as well for continuing that mandate. And then a couple of other things happened at the council last night. One was 2 bills passed that didn't get a lot of attention with everything else that's going on, but they were recommendations from our original gun violence prevention task force, and I'm very pleased that they passed to reduce gun violence in our communities. One had to do with gun safety and literature at stores where guns are sold, and the other had to do with hardening those stores. The smash and grab bill, some call it. It was done it's been done in other jurisdictions where these stores who sell guns would need to coordinate with our police department to make sure that folks can't just go in and steal the guns without a lot of obstacles in their way to doing that and illegally getting guns out on the street. So I want to thank the council. One bill passed 7-0 bipartisan, the other was 4-3. But I want to thank the council for passing those common sense legislation on guns. And then finally, I want to note that Thursday, we are breaking ground on the senior center in South County, a rebuild of that senior center and an expansion. So while all of these things are going on, all of these crises that we're dealing with, all of the progress that we're making, we continue to do our capital improvements in this county and move forward for a much better future than the one that we have. I want to say Happy New Year to everyone, and we will continue to build and make this a great year and make great progress. So back to you, Jeff.
Thank you, Mr. County Executive. I will kick things over to Dr. Kalyana Raman for some brief comments about county COVID metrics and response.
Thank you, County Executive. Wanted to provide some data on where we are. We've seen nearly a doubling in our case rate just in the past week, up to 176 per 100,000 per day today. We continue to reach new highs each day at this point. And that's pretty evident with our percent positivity as well. That's 25%. Those are the tests that are PCR, and if somebody reports an at-home to us, and as the county executive noted, not everybody's reporting those to us. So it is spreading. I think we all know that. And of course, the hospitalizations are increasing as well. Statewide, there are over 3,000, which is 50% more than any peak we've seen in the past, and we're still going up. This is putting tremendous strain on our hospitals. They came out with their declarations last week, but they're continuing to have to adjust, and that is going to change the patterns and the ways that people are getting at care. More surgeries that people really depend on and our need for their health are going to be postponed. Staffing ratios or changes, it's just going to take longer to get care. This has a ripple effect. Even if you don't think that you're going to be harmed because of COVID, we all need healthcare, and hospitals are one of the most important civic institutions we have. And so it is our responsibility to make sure that they can continue to function to take care of anybody when they come in. One of those things is a mask, wearing it in public areas. It's true, most people are wearing it, but not everyone is, and everyone needs to mask at this point in public areas in order to blunt the spread of COVID. A K95 mask is best. A surgical mask is really good, 3-ply. The thing with cloth masks is it needs to have multiple layers and a filter to be really effective. And we know people are using anything from really high quality cloth masks with those filters down to thin pieces of fabric that don't do anything. So if you're going to wear a cloth mask, make sure it actually has multiple layers and a filter. Otherwise, just use a surgical mask, and that makes your life easier. You know it's going to give you the protection and also protect others as well. Part of what we need folks to understand is that if you're vaccinated, please get your booster as well. While the majority, probably about 2/3 of the folks who are hospitalized are unvaccinated, most of the other third are people who are vaccinated but not boosted. So please get your booster. We've talked about the fact that the COVID vaccine is likely to become an annual vaccine. It is how vaccines work, particularly with your body's waning immunity and the fact that the viruses keep shifting. That's why we talk about variants. It's not a flaw in the vaccine. It is just how biology works. So please get your booster. And then I also want to share that contact tracing is going to continue to change. At these case rates, we cannot, nobody can keep up with the number of cases. Please, if you are positive, let others know who you've been in contact with that you are positive so they can make a decision. We're seeing on some days over 1,000 new cases a day for our county. That is a massive number. And then lastly, I just want to introduce Megan Pringle, who is the Department of Health's new Director of Communications. I suspect a good number of you know her. We're really excited to have her join us. With that, I'll turn it back over to you, Jeff.
Jeff, I left out one piece, of course, that I often do, that I intended to announce, which is that we told you last week that after having distributed 100,000 at home self-tests, COVID tests, that we had ordered another 200,000. We thought they would come last Thursday. We've continued to wait, and I believe that they are very close, if not here yet. But we said that we would tell you how we were going to distribute those 200,000. The first 100,000 we're sending straight over to Anne Arundel County Public Schools so that they can get them distributed through students to those families. So that will cover the 80-some thousand students plus staff and teachers to have at least one test as these kids are coming back into school. The other 100,000 will be distributed through our libraries, our churches, and some of our partners that have helped us to reach underserved communities. And they will be available in the coming weeks, but we will let you know when they're out. But the first priority was to get them to these families who have kids going back to school so that we can slow the spread of this virus in schools. Now
All
back.
right. With that, we'll take a few questions. First up, I've got Rob Lang from WBAL. As a reminder, please put your name and media affiliation in the chat, and I'll call on folks in that order.
Thanks, and Jeff, and good morning, and congratulations to Megan Pringle, who's a former colleague. Mr. County Executive, you heard the governor's announcements. What more does the state need to do? I take it you approve of what the governor announced today, but what more needs to be done?
I'm focused on the county. I think that the governor is doing a good job on this, that the governor has, when this pandemic started, he did the right thing, I think, the only thing that he could do and that any of us would do that wanted to save lives, which is to start closing some things down to slow the spread. And we're in a different place than we were back then with the vaccines, and our focus does need to be on getting people vaccinated and boosted. I was pleased to hear him say, wear the damn mask, and to implement that in county buildings, in state buildings. I feel like we have an ally in the governor's office in this battle, and I'm pleased about that.
But is there anything more needs to be done to make your job easier and Dr. K's job easier, make it easier in Anne Arundel County?
I think the most important thing, and if I had a criticism, it would be we want better coordination between our departments of health and the State Department of Health. More notice about when things are coming, more collaboration, and that's been an ongoing conversation. I've had that conversation with the governor, and he has the same criticism of the White House under both administrations. So we sort of joke about that, but. And I understand that sometimes you don't want news to be put out before you're ready when you're in government. So, but it's coordination. It's all about coordination, and I appreciate the support that he's given us for what we're doing in the county.
Fair enough. Thank you.
Thanks, Rob. Next up, Amy Simpson, Fox 45.
Good morning. Thanks, Jeff. County Executive. We heard from last night's meeting that this debate, this potential vote Friday on masking across the county is extremely divisive. You're asking people to contact their county council members, but it appears that 5 votes is not guaranteed. I'm curious your thoughts on how all of this is playing out in Anne Arundel County, even as so many of your surrounding jurisdictions have implemented or extended mask mandates in other ways.
Yeah, it's an interesting dynamic that we're watching in the public, and the way the public perception of government's role in fighting a pandemic and in protecting public health. In our county, we had 3 council members vote to reject state grant money to our Department of Public Health to fight COVID. And fight opioid addiction to keep that work going. We've had a lot of online criticism of anytime COVID is mentioned on my social media page. There are people who are saying that it's not serious, it's no worse than the common cold, and that government should not be intervening and playing a role in this. My view is that we have public health departments as part of government for a very good reason. and vaccines throughout history have worked, and government has played an important role, and most people appreciate that. And so this very, very small intrusion on people's lives, saying wear a mask when you walk into a public place, at a time when our hospitals, not only are our hospitals struggling, but our businesses are struggling. The retail operations, restaurants, they have staff that are not coming into work, not because they're necessarily heading to a hospital, they're vaccinated, but they're sick enough that they shouldn't be coming to work, and they're staying home as they should be. And that kind of a case rate is damaging to our businesses. It's certainly damaging to our public institutions. We have had police department, fire department, all of government agencies are reeling from the impact of this pandemic, from people getting infected. So we know that masks slow the spread. And I just think it's unfortunate that this issue has been politicized. Even people who were acknowledging that masks work and that mask mandates were not a problem back when we had them in effect all over the state are now saying no to mask mandates. I hope that some of the Republicans on our county council who have in the past not been very supportive of some of our actions on fighting this pandemic will see this as an important measure, a reasonable measure, and join their colleagues in other parts of the country who have supported mask mandates and move forward on it. I think it will help, but it's unfortunate that it's been politicized.
Any thoughts on when this vote happens Friday, if there are not 5 votes? What's next for Anne Arundel County?
We will continue to do everything we can to encourage people to wear masks and to fight against the spread of COVID-19 in our communities.
Appreciate it. Thank you. Stay healthy, everyone.
Thank you.
Thanks, Amy. Last call for questions. Again, media affiliation and name in the chat if you've got a question. All right, we'll wrap up. Thanks, everyone. We'll see you next week.